There are a number of health effects of tobacco, alcohol, and unhealthy food. They are really leading preventable causes of death, so that we know, for example, 40% of cancers are preventable, and tobacco smoking in particular is the biggest preventable cause of cancer. So if we can reduce these exposures to unhealthy things that we don't need to consume, we can also reduce disease. There's a clear and persistent relationship between non-communicable diseases and inequalities. So you're more likely to be exposed to the things that can cause cancer, diabetes, respiratory conditions, or heart disease if you live in a poorer area or have fewer resources.
The term commercial determinants of health is used to explain how the activities of businesses and industries can drive avoidable ill health, environmental damage, and social and economic inequalities. This is partly as a result of the direct impacts of the products, but it also captures how these are a result of the marketing and promotional practices of these industries, and also crucially how industries are often able to influence policy to protect their interests at the expense of public health. Attention tends to focus on the alcohol industry, the tobacco industry, and the unhealthy food and drinks industry. And this is because these are the leading drivers of ill health. And globally, if we add fossil fuels to the list, these four industries are responsible for around a third of all global deaths.
There's a real drive from industries to get governments to implement policies that focus on individual behaviours and this idea around personal choice. And there's extensive evidence around these policies that they are ineffective, they don't actually improve people's health, and they can in fact widen inequalities because they focus on problematic, or what is seen as problematic, individual behaviours that ensures that people aren't able to take up healthier options themselves. We often see higher amounts of advertisements for unhealthy food at bus stops, or we see more stores selling alcohol in areas of higher deprivation. And what that means is that the people who live in those areas are more exposed to marketing or the actual products themselves when they go about their daily lives.
We can all think of the neighbourhoods that we live in and the choices that are available to us. We can think of the types of products that are easily accessible within our neighbourhoods, be they alcohol or tobacco, or they might be health-promoting products such as fresh fruit and vegetables, or places that can encourage healthy activities. When we think about local level policies, we might want to think about creating more healthy environments, about limiting the availability of health-harming products such as alcohol, tobacco, and fast food. So policies to address this can improve our health and well-being.
The cost of living crisis poses major challenges for attempts to tackle the impacts of health-harming industries. It can seem really difficult when times are so tight to look to increase the cost of tobacco products, to increase minimum unit price for alcohol, or to put bans on buy one get one free promotions. But we also have to recognise how industries have sought to exploit the cost of living crisis, including by manipulating pricing. And this makes it even more important that we think about how we can tackle the impacts of these industries on health and on inequalities moving forward.
There needs to be a much more consistent approach across all health-harming industries. At the moment, it's so disparate and there's no coherence across different policy areas. Expecting individuals to change their behaviour when they're bombarded by unhealthy messaging is just unfair. We need to do what we can to tackle the availability, the price, and the promotion of these products.